Hello everyone, I am Dr. Bandita Sinha, consultant gynecologist at Reliance Hospital, Koperkherni. So today we will talk about something related to PCOS. Nowadays PCOS or PCOD, which is Polycystic Ovarian Syndrome, is an epidemic, or you can say is a household name nowadays. Is the commonest hormonal or metabolic disorder seen in females. It can happen between the age of 14 to 45 years. Mostly the symptoms with which the females present are irregular periods. The irregular periods can be delayed periods. There can be scanty blood flow. Sometimes there is complete absence of periods, which can be followed by heavy bleeding or prolonged bleeding. There are features of androgen excess. Androgen excess means there is increase in the male hormones in the body, and due to increased male hormones, there are certain features like acne on face, the skin can become oily, there are facial hairs, and hairs can also happen on the chest, abdomen, or in the chin area. There is thinning of hairs, female pattern of baldness, or sometimes there is excessive hair loss. Patients can have weight gain, which is excessive in a very short period of time. Some of them have mood changes, depression, irritability, and sometimes there is inability to conceive. These are the usual symptoms which mostly people present. 10% of these females, they do not have any symptoms, but still they are having, but 80% of patients who are having PCOD, they come with various kind of symptoms. How this PCO is diagnosed? This PCO is diagnosed with the signs and symptoms which the patient presents. Then there are sonography, where we can see that there are multiple small follicles in the ovary, and that is why this disease is named as Polycystic Ovarian Syndrome. And there are certain blood reports which help us to diagnose the condition of PCOD. Sometimes there are associated thyroid problem, or there is hyperprolactinemia which is associated with PCOS. This condition is a genetic condition, and sometimes it is related to lifestyle disturbances also. If it is not treated adequately, later on it can lead to infertility, diabetes mellitus. There can be cardiovascular disorder, endometrial cancer, recurrent abortions also can happen. Since it is basically a lifestyle disorder like diabetes, or it is a pre-runner of diabetes, so this is basically, it cannot be cured as such, but we have a control of this disease. What are the control? We need to have a basic diet, which is a PCO diet, which will be low in carbohydrate and fat, and high protein diet. Secondly, exercise plays a very important role to maintain a proper BMI. We need to reduce our weight, so a proper exercise schedule is very important. There are sometimes patients with lean PCOS. They are not obese, but still exercise of 30 to 45 minutes daily has a very good effect in hormonal control. Then we can also have our proper stress management things like yoga, meditation goes a long way. They can pursue some hobby, and sleep is very important. Have a proper sleep cycle. There should be regular timing for the sleep. That helps to bring back the hormones to normalcy. Avoid the electronic gadgets 1 hour before sleep. All these things helps to reduce the stress level. If we have a very good diet control and exercise and a stress management regime along with medications, we can control PCOS. Things can bring back to normal, and patients can conceive. The females can get back to their original weight, and life can be very smooth, and it will be stress free. In the whole month of September, we had done lots of online workshops and awareness sessions for the patients regarding PCOS. We are also running a PCO clinic in the hospital. We are available for physical consultation, as well as you can connect with us for online consultation. So PCO is nothing to worry about. Right diagnosis at right time helps in cure of this disease. Thank you so much.